Hi, I'm Dr. Larry Garber. I am an internist and medical director for informatics at Reliant Medical Group, formerly known as Fallon Clinic. I'm going to talk to you today about IMPACT, Improving Massachusetts Post-Acute Care Transfers. Throughout the country, patients are being discharged from hospitals and transferred to nursing facilities and home health agencies and back to their primary care physician millions of times a year. And throughout those transitions, there are numerous adverse events that occur to patients, and illnesses and even death, and numerous billions of dollars that are being wasted every year. Now, there was hope that meaningful use of electronic health records would solve this problem through the use of health information exchange, through the use of a continuity of care document, also known as the CCD. However, this is going to fall short of that goal because for several reasons. First of all, the CCD, while it's a good summary of the patient, does not have all of the data elements that are necessary to convey to the patient, to the doctor who is going to be caring for the patient, what the patient's baseline was, what their current state is, and what all of the future plans for that patient are. Second of all, the CCD is intended to be an electronic document which can be used for people who have electronic health records. But many organizations do not have electronic health records. So many nursing homes and skilled nursing facilities cannot take full advantage of using a CCD. And lastly, patients are being left out of these important transitions of care. They need to understand what their role is during the transition, and they cannot understand the medical terms that are present in the CCD. So the IMPACT project is designed to work on those three areas to improve them. So first of all, through a state and national process, we are taking the CCD and enhancing it to something we call the CCD Plus, which has all the data elements that are necessary for complete and effective transitions of care. Second of all, we're enabling organizations that do not have electronic health records to be able to receive them electronically. They'll be using an electronic tool that is going to be very inexpensive and will act as a surrogate electronic health record for them. It'll enable them to reuse data that they are already creating. So organizations that are creating MDS forms and OASIS forms or CMS 485 forms will be able to reuse that data and incorporate that into the CCD Plus. Of course, people who are using electronic health records will be able to use those directly to make this the most efficient process possible. And then lastly, we'll be creating a consumer-friendly translation tool that takes the CCD Plus and translates it into vocabulary and format that's understandable to patients and their families. We'll be piloting IMPACT throughout central Massachusetts, and then through a learning collaborative process, we'll be propagating it to the rest of Massachusetts and throughout the country wherever it is needed.